everyone. Good morning, good afternoon, good evening from wherever you're watching me. Welcome to Nostella's Corner. Welcome to the home of Water Must Flow. Already you know we must excrete and remove waste products from our system. That is Nostella's Corner for you. This morning, let's discuss a little about miscarriage. What do we call miscarriage? What is miscarriage? What do you know about miscarriage? How do you miscarriage? We need to know as a woman, what are the causes? How can you prevent it? Very, very important. We say miscarriage is a spontaneous loss of pregnancy before the 28th week of gestation. It is also known as spontaneous abortion, and it happens mostly during first trimester of pregnancy. Very, very important. Miscarriage. As a woman, when you have miscarriage, note, miscarriage is different from abortion. Miscarriage is spontaneous abortion. Why abortion is termination of pregnancy. So you need to know the difference between the two so that you don't mix words. You don't mix miscarriage. You don't use miscarriage as an abortion. So you have to be very careful when you're talking about the two, because there is difference between the two. And now let's talk about the types of miscarriage. Everything we'll be discussing today will be about miscarriage. So let's know the types of miscarriage. We have mixed miscarriage. This one, once you have this, there will be no bleeding. The cervical os is closed. The cervix is always closed. Then, during this mixed miscarriage, you will not have any fetal activity going on. Even the sac will be empty. So that is a mixed miscarriage. There is no vaginal bleeding. The cervix is closed, and there is no fetal activity. The sac that houses the baby, the fetus, will be closed. Then we have threatened miscarriage. This one, there is vaginal bleeding. There is bleeding from the vagina. Then you have closed cervix. Though the cervix is closed, but you will still be bleeding. Then there is fetal activity. Means the baby's life is at risk, because once the bleeding persists, you might end up the pregnancy will come down. So let's look at inevitable miscarriage. That one too, there is vaginal bleeding. The cervix begins to open up. You start seeing the cervix opening up, dilating. Then there is product of concept seen. Then you feel the product of concept at the above or below the cervix. It's always seen above the cervix. Above the cervix, that's where you see it. Then let's talk about incomplete miscarriage. When you have incomplete miscarriage, there is bleeding too. The cervix too is dilated. There is dilation of the cervix too. Then there are some product of concept that comes out. It comes out, and some will remain inside the uterus. So that is incomplete miscarriage. Then we have complete miscarriage. There is vaginal bleeding too. The cervix is closed. That is complete miscarriage. The cervix is closed. Then there is product of concept. The product of concept is completely expelled. Meanwhile, the cervix is still closed. Meaning the product of concept has been expelled with the bleeding. So what are the causes? What causes miscarriage? There are a lot of causes. Oh. There are a lot of causes of miscarriage that you need to know. One, there is placenta problem, meaning that when the placenta is developing, the development is not good. It's not well developed, so you can have miscarriage with that. Then the baby parts are not forming well. That's chromosome problem. There's a lot of chromosome DNA that is produced or pushed, or there is no enough. Then you have age too. You have age, you have obesity when you are on the large side. Then you have, for those that smokes, smoking too cause miscarriage. Alcohol intake cause miscarriage. When you drink a lot of caffeine, it causes a miscarriage. There's then for those that are diabetic too, with lupus, those that are having lupus, that are having kidney issue too, it causes miscarriage. Then severe hypertension, high blood pressure causes it. Then you have hyperthyroidism. Hyperthyroidism too causes it. Then some medications you take causes miscarriage. Some of the medications you take without being prescribed, or even if they are prescribed, there are some drugs that tampers with your uterus that can make you have a miscarriage. Then infection can cause miscarriage. Syphilis, gonorrhea, malaria properly treated, all these causes it. HIV, chlamydia, they cause it. Then how can you prevent miscarriage? Take your folic acid regularly. If you have a healthy weight, you can prevent it. Watch your weight, watch your lifestyle. Make sure you have a healthy lifestyle. Make sure you stop caffeine. During pregnancy, don't take caffeine. It normally gives an issue. Then prevent smoking, prevent alcohol intake, which is very, very important. Then try and treat any infection you are having. Treat it. It will help you a lot. Then avoid exercise that can cause miscarriage. Very, very important. There are some exercises that you don't perform during pregnancy. You avoid it. And anything that can cause hazard to your baby or you yourself, you avoid it. Then medication, as we said, medications too. Try and see your doctor and let them prescribe a good medication for you. Don't just do self-medication. They are not good for your body. Then try and take healthy diets. Maintain a healthy diet during pregnancy. Very, very important. With all this, you will find out you live a healthy life. You carry your baby to term. You deliver at the normal time you are supposed to deliver. You will get to term. But if you don't avoid all this, you are likely going to have miscarriage. It's painful when you carry pregnancy and end up losing it. It's very, very painful. So endeavor to live a healthy lifestyle. Reduce your weight. Do exercise that will not terminate your pregnancy, that will not bring it down, that will not make you have miscarriage. Very, very important. At Nostella's Corner, we'll always teach you what to do. Have a wonderful day.